Greetings, this is Timothy Youngs, the Digital Apothecary, and today I'm going to be talking about basically how medications are packaged and dispensed from the pharmacy. Now, the reason I'm doing this is because I have so many questions I receive from founders or entrepreneurs interested in the pharmacy space, and what they'll ask me is essentially, how do medications get to patients, and what are different ways that they can go about. And I thought this might be good because I'm going to start a series on medication adherence companies and their devices, so I thought it might be a good review. So first off, if you go into a pharmacy, you can buy things over the counter, and they come different ways. So you get like a bottle of ibuprofen, for instance, and you buy a bottle, and usually it's child protected. You line up the lines, you pop, and there you go. So you got some medications in there, and I'm gonna put these to the side, but not too hard, but it's a bottle. Then the other option is basically you have medications that are put in a blister pack. These have basically the same information. For instance, there's a lot number in case you want to do a recall. Drug. These are probiotics, and then also expiration date. But they're not child safe because you could just slide it there and pop out and get the drug easily. Now, in other countries, what you'll notice is that some medications just come in a box full of these things, and that's basically how they dispense medications. So a month's supply is basically in a box. It comes in full packaging or similar, and patients just pop them out and take them. And I often think that's very interesting compared to the United States, which uses the amber dram vials. So here, for instance, we have CVS and we have Walgreens. There's a whole bunch of other ones. And the thing about them is that there's always differences in terms of how these bottles are used. First off, they all hold different sizes, so we call them dram sizes in terms of how many tablets or capsules it can hold, and also how they may work. So CVS, you have to push down to pop open the thing, close, twist, and such. Take Walgreens, for instance, you actually have the safety cap here. You have to pull down, and then you can twist it and open it up. Now, what's a cool feature is Walmart and Walgreens and a few other pharmacies, they use these kind of screw systems where you can do this. And now if you are a person that has difficulty opening a bottle because maybe you have, let's say, osteoarthritis and you have wrist problems or some other issues, this makes it easier. But this defeats the whole child-proofing concept. So I'm going to leave that open. Now, why do we do this? Big thing is this, because this is kind of an easy process. If you really want to get to the bottom, there'll be huge stock bottles, usually about 1,000 count in them. And what you would do is, let's go back to these ibuprofen tablets. We use the example, use a counting tray. So basically, we usually end up counting by 5. So let's suppose I was doing 10. Then you take this one in here, and what you would then do is take that and put it back into the stock file. And then this, you would just drop into the medications you're going to fill, put on, and you would put a label on. Now, labels are pretty much the same. Usually there's names. So this is my medication. I take this for seasonal allergies. Take 1 tablet by mouth daily. CVS rolled out this new thing to help out patients understand medications when to take them. So morning, midday, evening, bedtime. And this one says morning, take 1 tablet. Now, if we think about in terms of a mathematical approach, this is once a day. So you take 1, and it's 30-day supply for a month. So 30. Now, 30 will fit in there. What if you got 3 months supply? So times 3, and now it's 90. Okay. Well, let's do something different. What if you had to take, let's say, 1 capsule by mouth 3 times a day? Let's say that was like gabapentin, used for chronic pain or seizures. So that'd be 90, and this was you got 3 months supply. Now you have 270. And those things can be actually bigger. And some medications are a lot huger. So metformin and such, which are pretty big. So that's why you end up needing different bottle sizes. So why do I keep harping on this? Well, one of the things that I'm going to address here is basically this whole process that, let's take this one company, for example. So I have a Pillsy bottle cap here. And this is where you're going to smart pill bottles. If you look here, this is very similar. Again, you pop down thing to open it up. But now, what can this cap fit on? You take the CVS bottle and try squeezing it on. It doesn't fit. And now if we take this other large dram bottle, it's too small. So there again, this is where you have to consider if you're a company that's trying to make these sensors or trying to make anything else, is basically how big of what can your product basically fit on, and what can it tie to. And I think this is always a consideration, because this kind of makes things difficult at the end of the day. And I'll be talking about these companies in the future a little bit. So overall, these things are cheap, and that's why it makes it kind of easy, because you just need a technician or pharmacist to basically count the medication. You can also have machines that basically will take medications that are like frequent flyers, so like lisinopril and things like that, and they'll basically dispense a robot that will put it in here and put a label on, and then the pharmacist will verify it. So that's one way you can do like automation, but overall it's kind of a cheap process. Now, conversely, is we've been seeing these things have been picking up and getting a lot of attraction. So what are these? Well, these are basically strip packaging of medications, and the other way to call it is a multi-dose delivery system. They're actually very common overseas. They've been coming to the U.S. and they've been used in the U.S. for a long time as well. But they've been usually used at like long-term care facility, nursing facilities, because you would give a strip of medications and nurse would just pull off and choose and give this to a patient for administration. Now, companies like PillPack, Alto Pharmacy, and others have gone to this business for basically to help out with adherence or for organization. That's why I think these things are really good for organization medications, because just put them all in there. Some caveats: easy to open, might not be child proof for that reason. But before I get to some other negatives, like you can see how this works. Like you can see it's timed like 9 a.m., 9 p.m., sunrise, nighttime. Gives like the what's in there: aspirin, ibuprofen, how many tabs are in there. So you can do different quantities. So like 2 versus 3 ibuprofen are in this. So it's kind of neat. And for those who are wondering, this is actually a dummy patient. This was given to me from RxSafe, so this is not a real life person. Anyway, so what's some negatives as well to consider? Okay, what if you were a patient that goes to your physician and they say, okay, you have a new prescription, but you have this at home. Well, now you have to take this, and you have to take this. Or what if someone says, well, I want you to change a dose or stop taking medication or hold it. Well, now you have to figure out, okay, what's in here? What do I not need to take? And so you can see it gets a little cumbersome. I do like the system because it is kind of a good organization facet for it, because for a lot of patients, they just know, okay, I'm taking this and that, and I don't have to like go and say, I have like 10 different medications, which bottle am I going to open and take? So it does have some benefits from that standpoint. And like, if I take my medication at home in the morning, but I'm going to be out in the evening, so I'll just take this, I'll put it in my pocket, and then that way I know to take it when I'm out and about. So that's strip packaging. Oh, and the other thing to talk about is the fact that this is also, if you haven't realized, this takes a lot of labor in terms of having some machinery basically handling this. And what I mean is there's a whole bunch of companies that produce strip packaging machines that would basically have medications. You fill them and such. You need technicians to fill like whatever goes in there. And those machines cost a lot. TCGRX, RxSafe, Parata, those are some examples. I would just name a few. And it's kind of like a large startup cost just to get into that business, because while these are cheap and you can just order thousands of these, to basically buy the machines to do this is going to be a large amount of money up front. So considerations for this. The other one I'm going to talk about is basically blister packaging, or bingo packs as I used to call them. When I worked in independent pharmacies, these were actually pretty popular. So the whole concept is if you open it, and these would be filled with the medications, and you would just pop them out. Again, these are really common in long-term care facilities. This is a weekly pill pack, and these come in different sizes. So like if you can imagine, like they can hold a different amount of medications in them, and that's kind of what their limit is. So how it would work in this case, this is a cold press, which what I mean is it's just glue. Some of them you actually have to use like a heating press in order to activate the glue to make them stick together. And what you would do is you would open this up. And what's supposed to happen is you're supposed to take this, and I'm going to be careful here because these things usually what they come with is an insert from the company that you rest this plastic thing in. So you're not really supposed to fill it like this. This is actually incorrect. They have like these little inserts, but you would go through, and what you would do is over on this side you have the prescriptions. So let's suppose this had like 10 different medications. So you can say, okay, I want to take. You take 2 tablets in the morning, 1 tablet at noon, 1 in the evening. And imagine these are just different medications. So again, you just keep going through that, and go through. I'll just put these back. So those are all in there, and then you finish putting this to the side. And then what you do with this is you hold that down. And this is not very clean because I'm not really doing this correctly. So this is not exactly how it's supposed to work, but you're kind of getting the idea here. So now these guys are all in the packs. And what you would then do is then, if you were a patient, you could say, okay, it's Sunday. Oh, it's morning time. What do I take? So, okay, I'm taking this one, fold over, morning, and you would just open it, and then there's your medication you would take. So this could be like all your morning medications right there. So while this is a little attractive, there are machines that do this, and again, this can be done by hand. You don't really need, it's not too laborious. Patients like this and pharmacies like to dispense this like independents because basically this is a week's supply of medications right up front. It's not a lot of like complications to it. So in terms of like organization, these are two approaches, but you can see there's different ways of basically going about it. So that's going to basically wrap up my conversation about different ways medications are dispensed from a pharmacy. And these are some considerations just about, even if you're a company that's looking to get into space, just what's out there in terms of currently available and being utilized. I would say this is the most common, maybe 90%. This is growing by a lot of different ventures. You see a lot of independent pharmacies getting into it, long-term care facilities, same thing, long-term care facilities, but also in addition, a lot of independents are offering these services to their patients to basically bring in attraction. But you also have companies like CVS who now are also doing their own structured packaging service that they're rolling out, and I think others will get on board. So these are just, food for thought. Feel free to leave any comments or any thoughts or any questions that you want clarifications on. And this is Timothy Young from the Digital Apothecary, and have a good day.